Here, as COVID-19 cases continue to rise, we're keeping a close eye on some of the youngest patients dealing with the virus.
Yeah, this is a big concern here. Dr. Magna is the Chair of Pediatrics at Bridgeport Hospital and the Regional Medical Director for Inpatient Pediatric Services at Yale-New Haven Children's Hospital. Dr. Diaz, thanks so much for joining us on the News at 4.
Well, thank you for having me.
So we're hearing a lot about the rise in youth cases with COVID-19 because of the Delta variant. How concerned should parents be about this surge, and how severe are some of the cases that we're seeing?
Yeah, I think as a parent myself, I think, we should be concerned. We are definitely seeing an increase in cases across the country. The American Academy of Pediatrics reported that just last week, almost 100,000 kids were diagnosed with COVID just in that 1 week. And, I think we're fortunate to have a pretty good vaccination rate overall in the state of Connecticut, but we do have pockets where that's higher and lower. And so I do think that it is important for parents to recognize that we are seeing kids who are getting hospitalized again with COVID, unfortunately.
Dr. Diaz, a lot of parents out there who are getting ready to send their child back to school. Maybe their child's vaccinated if they're in an older grade, but if they're really young, maybe they aren't eligible yet to have gotten their vaccine. What can these parents do to keep their kids safe and healthy?
I would say that there's several things that they can do to keep their kids safe and healthy. One you've already mentioned is, putting their masks on. I think that is something that has been proven as a, kind of foundational thing for us. Unfortunately, you are absolutely right. The majority of our kids are not vaccinated. They're not eligible to be vaccinated. And so, washing hands is an important piece of things, mainly because it's also going to keep you from getting other respiratory illnesses, which is going to make it difficult to know, is this COVID or not? And then just, keeping safe in terms of mental health. I think it's important for parents to take a very reassuring attitude with their children and to make sure that they are able to shield them from some of the news and things like that as adults we are privy to.
No, that's a good point. We've been talking a lot about COVID-19 vaccines for kids. How important is it for parents to get their child vaccinated when they are eligible for a vaccine?
I think when they're eligible for a vaccine, it's incredibly important. I think, right now it's the kids who are age 12 and above, and that's an important age group for spreading virus. And so, and that's an age group where kids are just social. They want to be with each other, and we want to allow them to be with each other safely. So it's a really important a tool that we have to try to keep our kids safe. Unfortunately, in adolescence, this has now become one of the top 10 causes of death in kids. And so while it's something that luckily most kids don't die from COVID, some do, and we want to make sure that they stay as safe as possible and in school as much as we can keep them in school in person.
All right, Dr. Diaz, thanks for joining us this afternoon. We appreciate it.
Thank you.